People always think that I'm crying, and I'm not crying at all. How could my eyes be dry and watery at the same time? You guessed it, this entire video is about watery eyes. And today we are getting to the bottom of it. Let's go. Hi, I'm Dr. C, a double board certified optometrist, and I am here today to explain everything about eyes so that you can understand clearly and easily.
It's because I care.
Before we move on, please like, subscribe, and ring the bell so you don't miss any future videos because what's coming is awesome. Now, the good news is that your eyes water for 3 main reasons. And once you understand these 3 reasons, then everything else becomes so much clearer and much less overwhelming. Let's go through a little mini anatomy lesson. So your tears are actually made in the lacrimal gland, and they will flow onto the surface of the eye and leave your eye via 2 little tubes called puncta and essentially drain into your nose. I like to explain this to my patients with the analogy of a faucet. So if you think about it, the lacrimal gland really acts like the faucet. That's what's going to release the tears onto the surface of the eye. Then the actual eye itself is the sink basin, and the tear duct where all your tears flow out of is the drain. And when we think about it like this, we could further understand that there are only 3 ways that your eyes can be leaking. Reason number 1, the faucet is on too high. The first reason your eyes water is that you're making too many tears.
So now it's my fault.
This is usually called reflex tearing. So your eyes are incredibly protective, which is completely normal. It's evolutionary. If ever there's anything that bothers your eye, it sends a signal to your brain to say, hey, protect me. Let's get some more tears on the surface of the eye and flush whatever's bugging me away. And your brain will send the signal to make more tears. But these tears are made in an emergency. So they're not the great quality tears that you're used to. They're more watery. So they're not meant to stick on your eyes. They're really meant just to get you out of this situation. And that's why these tears won't stick and they're gonna roll off the surface of your cheek. There are a bunch of reasons that this could happen. So let's go over just a few of the most common ones. The first could be cold air or wind. Everybody's felt this. Kind of you go outside, whether it's in the winter and you kind of feel like that cool breeze and you're not wearing any glasses, or even in the summertime if you want to go for a bike ride and your eyes just start leaking, the wind will just destabilize or really send a signal to your brain to say, hey, let's make more tears. We need to protect the eye.
I'm here for you.
Bright sunlight, fragrances, like really strong smells. You walk into a, store and you smell something and your eyes start watering because it's just overwhelming. It could be dust, pollution, allergies. There are so many reasons that things can bother your eye to make your eyes overwater. And it's important to understand what your triggers are so that you could essentially avoid them at all costs.
Never doing that again.
Now, one of the most confusing triggers for watery eyes is actually dry eye. And the question my patients always ask me, and that's super valid, is how could my eyes be dry and watery at the same time?
Mathematically, that is possible.
The reason this happens is because when your eyes are so dry, it sends that signal to your brain to make those tears to help protect the surface of the eye. And this can be exacerbated if you have things like MGD, for example, meibomian gland dysfunction. If the oily part of your tears aren't working well and aren't keeping the tears stuck to the eye, this will also make them flow off. So this kind of vicious cycle is one of the reasons why your eyes could actually be tearing when they're in fact dry. So the key here, if you have to remember one thing, is let's find what your specific trigger is. We got to think, hey, what's causing my eye to overreact? And then we could find the appropriate solution.
That's a good plan.
For example, if your faucet is overactive when you go outside, a lot of my patients will wear protective glasses or really wraparound glasses to minimize the amount of wind and cold that gets to their eyes. Sometimes goggles in the winter when they're skiing can really help this. And if it continues, it just takes a matter of getting, the eye getting used to the environment. But these are small things and small little tweaks that we can make to sort of help on the long run. We also want to improve the tear stability, and this is where getting to the root cause of problems is so key in any area of life, but in eyes specifically, because if we have a tear film that isn't stable, the teeniest trigger will affect it. Versus if we really support our tear film and have a healthy, strong one, it'll take way more trigger to bother it. And that's why we treat dry eye at the root cause. So if it's treating the lipid layer, then we do that. And I will link the videos where we do go more in depth into MGD, so you could watch those. And also make sure to put your questions in the comments below, because I will use them to make future videos. Immediate fixes or things that can help are using eye drops, specifically eye drops that have a bit of a lipid layer inside protection, because that will help keep the tears on the surface of the eye. Addressing any kind of environmental factors. Environment truly affects our eyes. I would love to prescribe tropical vacations for all of my patients, but if that isn't possible, then a humidifier beside your bed will definitely do the trick and help a lot. Reason number 2, the drain is not working properly. Your tears have to go down the drain.
That's just how it works.
That is the basic principle of keeping your tears on the eye and having them do what they're supposed to do. So if those little openings either are blocked, are too narrow, aren't actually facing where they have to face, because sometimes people will have eyelids that turn out a little bit, that's called ectropion, or eyelids that turn in, called entropion, making it so that no matter where the water goes, it is not going down the tube. And if that is the case, there's nowhere else to go for the water than to leak down your cheek. Now, when I'm thinking of a blocked duct, typically this will be more on one side. It will be a patient that will tell me, my right eye is constantly leaking. I walk around with a Kleenex up my sleeve, and people always ask me if I'm crying because I'm constantly wiping my eyes. And if that's the case, then what we can do in office is actually a little procedure that will flush out the drain and see if there's an actual blockage there. Either the water will unblock the blockage, if that was the case, or we could refer out for a little surgery that will take care of it. Similarly to when the eyelid is misaligned from the eye, like I was speaking about before. So if the eyelid is too much towards the outside or too much towards the inside, there are also treatments that can be done, or minor surgeries, to have the lid be positioned properly on the surface of the eye so that it can get the tears to flow into the drain where it's meant to be.
This is where I belong.
Another reason that the tears may not be getting to the drain is that the lids don't close properly. So it's not flowing the tears. This could be because of facial nerve weakness. It could be just because the lids don't physically close. There can be issues because of prior surgeries or things like that. There's a little test that we can do in clinic actually, where we put a little bit of yellow dye in the eye and we wait 5 minutes and see, has that dye drained or has it remained on the surface of the eye? And that's another easy way for us to be able to assess if there's a blockage or not. Reason number 3, water from the faucet is not getting to the drain. And this could be because of a bunch of things. Like usual, let's go through the most common. One of them is we have a little tissue on our eye called the conjunctiva. And sometimes this tissue could be a little looser than it should be. And it physically will clump up and block the passage. And this will cause an actual blockage so that the tears don't flow towards the drain. Also, what we were talking about before, eyelid positioning. So if an eyelid is too forward or too in, this won't make the flow as smooth. Lid issues are also something that we look at when we're looking in the microscope, and we could assess and see, is this the root cause of why this person's eyes are tearing? The most important takeaway from today is when someone says, my eyes water, the correct step isn't to jump to a treatment. The correct step is to ask why. Is it an overactive faucet? Is it a drainage problem? Is it that the tears can't get to the drain? Is it dry eye, or a slew of a bunch of other reasons that it can cause? And once we know that, then we're in the right position to actually treat the root problem and get your eyes to stop watering. If this resonated with you, please like this video, subscribe, and ring the bell so you don't miss any future ones, because we will definitely dive into this further and get you to understand and treat your watery eyes. And if you know someone who has watery eyes, please share this video with them so we could spread the word. I'm Dr. C. Take care of your eyes, and I'll see you in the next one.